I feel like it's too good to be true. Honestly speaking, if they can't afford right now, they can't afford basic medical fees like clinics are still having shortage of medicals, of pills or any other kind of medication. How are they going to afford the whole country medical aid? Because medical aids are actually expensive. So first they have to actually cover the little issues like clinics. They should have enough medicines, they should have enough doctors and nurses. As long as that is still a problem, I don't think that this new initiative is going to work. It's going to be a very big problem. I feel it's just a strategy to get more votes. For me, it's just a strategy to get more votes, because as soon as they are still voted into power, it's just going to be, yeah, we started an initiative, but it's not going to go anywhere. It's going to wait another 5 years. When it's time for vote again, they're going to wake it up and say, no, we've made such progress, but you're going to find out it's only a 10% or a 5% progress or less, because it's really, really low. It's not promising at all.
Plan is good, the idea is good. I just don't know if we're ready for it. In the sense that we need free healthcare for everyone, but at whose expense? Because the government says that it's free healthcare for all, including private and public sector. So it would help take the burden off the public sector, because public sector is overwhelmed and swamped, with the amount of patients there is and the shortfall of doctors and resources. But how is it going to work in private? Like, how is the billing going to work? And I think a lot of people are very confused. And I think that we would like a little bit more clarity on that, because if it's free healthcare for all, that's what we need to do. Because I've seen in the last 3 years here in Randburg that patients have to actually walk around and go and find cheaper treatment, because that's what they can afford. And it would be amazing that if everyone could get equal and fair treatment. So the idea is good. It's just that, are there enough resources in terms of where's the implementation of funding, and does the healthcare practitioners know what's going to happen? I'm for it. We don't know anything about it as yet.
How will this bill affect the professionals' earning?
So that's the main thing. No one understands what's happening. I think I've been trying to read up on it and comparing it to the NHS in the UK. And unfortunately, the NHS is almost collapsed because of the funding situation. So how is it going to work in a third world country? Apparently, medical aids are fighting against it. I'm not understanding, I'm not sure why. Because how does it work? Do your private patients get preference? Do NHI patients get preference? No one understands. So if there was a better understanding on how billing would work, how funding would work, I think people would be a bit more open and understanding and accept it. But when there's almost like a veil on top of this whole NHI, no one knows what's happening. I think a lot of people are scared. A lot of healthcare professionals that I know are ready to leave the country.
Do you trust the government in terms of payments, and have you worked with the government before? Did they pay in time? Were they trustworthy?
So I do work with the government. I work as a sessional doctor at Charlotte. Payment, with government, there's always issues with payments, but we have been paid. We are paid. So that regard, I think it's okay. But on a larger scale with NHI, now free healthcare for all, where is the money going to come from?
I feel NHI is very good because it's going to pay the government hospital, and when our children, our babies sick, we can take them quickly to hospital, government hospital. I think it's very good.
It was mixed feelings, basically. In a sense, it was obvious that it's a political statement. We're having the elections, but one will be naive if you think that the healthcare can carry on as it is, privately and publicly. So something needs to be done. The two things that this administration and the ANC has done ever since it took over, two things that it did very badly was education and healthcare. And if you look at that, it is criminal to withhold proper healthcare from the people, and it's criminal to have poor education for your people. So You know, private healthcare and public healthcare has moved away massively. You know, so private healthcare is one of the best systems in the world, our private healthcare. But it's unaffordable to the majority of the people, and that's not right. We cannot charge dollar rate fees because we're not living in United States, you know, privately. So there's something wrong with that. You can't go and see a cardiologist and he charge you 10,000 rand per visit because, you know, he feels that that's the fee that he's allowed to charge. That's just absurd. But yet again, you cannot wait for basic treatment in the public health sector for months and months, and you know, have basic medication and basic health care not being provided. You cannot have that.
How will this affect the doctor's earnings, your business? Will it really damage how you've been earning a living?
The truth is, I don't know. Medical inflation is one of the biggest drivers of inflation at the moment. And it is all because of private healthcare, the standard of living that private doctors need to manage and to have, you know, private schools, you know, all those things, the running costs. So you need to break it up in a personal capacity and in a business capacity. So, and the lower you down on the chain, you know, if you, like myself, being in private healthcare at a primary level, then most probably the impact will be not as massive as if you're a super specialist, you know, with expensive equipment and need to charge high fees to justify that. So for them, so your specialist is most probably going to be more affected financially by the NHI than your primary care providers like myself.
And doctor, you've probably worked with the government before, dealt with them before. The stories of corruption, slow payments, and everything. Do you trust them that they will be able to administer your finances?
Not at all. You just take one simple example, the Workmen's Compensation Fund. It's a simple fund. It is minute compared to what the NHI is going to be. And ask anybody that deal with the Workmen's Compensation Fund, how long do they wait for payments? What absolute nightmare it is to provide a service to somebody that's injured, seriously injured, and how long that compensation takes to be paid out. An absolute nightmare. In fact, I don't deal with them anymore.
You know, I see the benefit in it. I don't want to lie to you. I think that when it comes to private healthcare, you are treated so much better. You feel like you matter, you know. And when you in a government hospital, the problem is that you wait very long. Number one. Number two, they postpone a lot. All right, there are a lot of negatives in government healthcare. So if we were to go to private healthcare, you know, a lot would just be so much better, man. People would get better healthcare. People would feel better, I believe. Amount of tax, and if you look at how many people stay in South Africa, I believe, and the amount of people who are working has actually grown, you understand? And I believe that if government really wanted to, and if you look at all the fruitless spending that government is doing, you know, that means that they have the money, you know, it just needs to be directed to the right direction, you know, directed to better places where they would actually be able to help those who are in need.